Hello all, myself Helen Najoy, lecturer from SNS College of Allied Health Science in the Department of Radiography and Imaging Technology. I am going to discuss a topic about Operation Theatre Radiography. Operation Theatre Radiography is required during the operation. The theatre radiography guides the surgeons to carry out accurate surgery of the patient. Orthopedic surgeons need to use mobile X-rays or mobile C-arm to check for proper reduction of fractures in OT. The procedure is commonly performed in dislocation of the hip, fracture of the femur, and other corrective orthopedic surgery. The general surgeons, neurosurgeons, and urology surgeons need imaging facilities for stone extraction, nephrostomy, retrograde pylography, cholangiography, arteriography, and iotography. The mobile, portable X-ray units, C-arm, modern mobile digital image intensifiers are used for theatre radiography. This is how a theatre radiography performs. What are the general guidelines? After receiving the OT radiography requisition form, the radiographer should communicate with the theatre staff and ensure that the correct X-ray unit and accessory should be available in OT for the examination. To prevent the spread of infection in the operation theatre, the mobile, C-arm X-ray units and cassette should clean with antiseptic solution before moving into infection-controlled OT. After completion of the theatre radiographic examination, the equipment should be cleaned again with the antiseptic solution. To reduce the risk of transmitting pathogens in the OT, the cassette must be covered with plastic sheets or sterile towels, and the radiographer should remove their uniforms and wear gowns, disposable gloves and face mask. The radiographer should introduce themselves to the surgeon and take the necessary guidelines for the procedure. The radiographers should not stand too close to a staff member and do not touch the sterile area of the operation table. If the image intensifier is used in theatre radiography, the radiographer should test the unit and check the hard drive space before the examination. The mobile image intensifier is used to capture the real-time images to assist the surgeon in positioning the guide wire in orthopedic procedures. The digital images must be captured in a sequence so the surgeon can view the image and access the surgical procedure. The X-ray units should be covered with plastic coverings to reduce blood contamination during the surgical procedures, and the X-ray unit should carefully push over a patient without touching the sterile area. The radiographers do not handle the sterile objects. The surgeons or the scrubbed nurse gives the position during the procedure. Clear instruction is made by the radiographer before the exposure. The staff must stand at a maximum distance from the X-ray tube and nobody should enter the controlled area during the exposure. If manual processing is used, the darkroom facility should be housed in the OT. The processing solution must be tested by the radiographer prior to the film processing. The radiographer should not move out from the OT. The film is processed inside the OT darkroom. After film processing, the film is brought back to the surgeon to evaluate the operation. So this is how the evaluation of the X-rays is done. What are the radiation protection? Various precautions and safety measures are used to reduce the radiation dose to the technologists and other persons in the OT. The examination should be justified. The exposure should be as low as reasonably achievable in the ALARA principle. 3 basic methods for reducing exposure should be done. Minimize exposure time, maximize distance from the X-ray tube, use proper shielding. The exposure cable must be 2 meters long to allow the radiographer to stand distant from the irradiated patient. The staff must stand at the maximum distance from the X-ray tube and nobody should enter the controlled area during the procedure. The radiotechnologist, OT staff and surgeon should protect themselves with the lead apron, which is 0.25 mm thickness of the lead equivalent, and lead gloves. The radiotechnologist should use personal monitoring devices and stand at a right angle to the tube. The radiotechnologist should not use correct exposure factors. The exposure should be recorded to avoid repeat exposure. The radiotechnologist must use high kV, low MAS, shortest exposure time and collimated radiation field size. The other OT staff should stand outside the radiation field, and pregnant women and people under 18 years should not involve in assisting. High-speed screen film combinators should be used to reduce the exposure and exposure time. So this is how an X-ray is performed in the OT. This is how a machine is operated in the OT, X-ray machine. Thank you.